In this video, we are going to see some details about femoral triangle. So as you know, this is the first important space seen in the lower limb and it is related to upper one-third of the thigh region. So now we are going to see the details of femoral triangle. So before going into this femoral triangle space, first we have to know in thigh region we will be having layers such as from superficial to deep we will be removing skin, later we will be removing superficial fascia and deep fascia, which we will call here as fascia lata. Then after we will be having some cutaneous structures such as cutaneous nerves and vessels. After removing those structures also, we will be having all these deep structures underneath all those layers. So first we are going to deal about femoral triangle, which is beneath or deep structure of the thigh region. This is a space which is seen in the upper one-third of the thigh region. So this is the upper one-third of thigh region. So here we can make out a triangular space with following boundaries such as femoral triangle is a triangular space, obviously we will be having boundaries such as base and apex. This is considered as an inverted triangular shaped space. So apex will be directed downwards and base will be seen in the upper part. So the base is formed by the inguinal ligament, which you are seeing here. So this is the inguinal ligament which is going to form the base of femoral triangle. Then after we will be having boundaries such as right side and or medial side and lateral side boundaries. So this is considered as medial boundary and this is considered as lateral boundary. The medial boundary is formed by adductor longus muscle. So adductor longus again will be carrying lateral border along with its medial border. So this border we are going to take for femoral triangle. So medial boundary of femoral triangle is formed by medial border of adductor longus muscle. Talking about the lateral boundary of femoral triangle is formed by the muscle called sartorius, and this sartorius muscle again will be carrying lateral border and medial border. The medial border of sartorius is taking into femoral triangle. So boundary which is forming the medial wall is by medial border of sartorius and the lateral boundary is formed by again medial border of adductor longus. So as we are taking medial border of adductor longus, we are going to include this particular muscle in the floor of femoral triangle. So we have seen boundaries such as base, which is formed by inguinal ligament, and then we will be having medial boundary formed by medial border of adductor longus and lateral boundary which is formed by again medial border of sartorius muscle. Now talking about the apex. The apex is formed by approximation of medial and lateral boundary. So medial boundary adductor longus and lateral boundary sartorius together joining and forming the apex of femoral triangle. So we'll be having base, apex, medial boundary and lateral boundary. So here talking about the roof of femoral triangle, we have removed roof by dividing into layers such as the third layer, which we will call as deep fascia or fascia lata, is considered as roof of the femoral triangle. After seeing the contents of the femoral triangle, we will approach the another boundary called floor of the femoral triangle, which will be much easier to understand. So here we had seen some boundaries. Now we are going to deal with important thing about femoral triangle, that is the space with its contents. So talking about the space, so femoral triangle will be having space as such we discussed. It is a triangular space. So it will be having again a space filled with major vessels and nerves. So such as first we will be having this triangular space carrying structures such as first one medially we will be having vein called femoral vein. The vein which is present in femoral triangle, so we are calling it as femoral vein with its tributaries. Same way, lateral to femoral vein, we'll be having an artery called femoral artery with its branches again. Then after, we'll be having lateralmost structure as nerve called as femoral nerve. So these are the important structures which are to be seen in femoral triangle. Along with these structures, we'll be having some other structures such as deep inguinal lymph nodes, and we'll be having lateral cutaneous nerve of thigh along with it. So then after, we'll be having a nerve called genitofemoral nerve which is passing above the femoral artery. We'll be having femoral branch of genitofemoral nerve just above the femoral artery. So all these are considered as contents of femoral triangle. So major contents as we discussed from medial to lateral, first one will be femoral vein with its tributaries. Lateral to that we will be having femoral artery with its branches. Lateral to that we will be having femoral nerve with its branches again, along with deep inguinal lymph nodes. So first structure we are going to see in femoral triangle is femoral vein. As you see here, the medial most content of femoral triangle is femoral vein. So to talk about this femoral vein, it is actually a continuation of popliteal vein which is coming from the popliteal fossa, which we will deal later. So we will be having popliteal fossa, a space again which is present behind the knee joint. So in the popliteal fossa we will be having contents such as popliteal vein, artery, and that popliteal vein which is going to ascend upwards. So ascending upwards and reaching the femoral triangle, so we are calling that vein as femoral vein. So it is a continuation of popliteal vein from the popliteal fossa which is reaching the femoral triangle. Then after, it is passing just below this inguinal ligament and going upwards, and here we will call that as, that is in the pelvic region, we are calling it as an external iliac vein. So femoral vein, it is a continuation of popliteal vein which is reaching the femoral triangle and seen as a medial most structure of femoral triangle. Later, it is passing below the inguinal ligament and going to pass upwards to reach the pelvic region to form a vein called external iliac vein. Here you can make out one important tributary of femoral vein, that is great saphenous vein. So the vein which you are seeing here is great saphenous vein, which is the longest cutaneous vein seen in our body, which is going to drain in the femoral vein by piercing cribriform fascia, reaching the saphenous opening. Then after, it is going to open in this particular vein called femoral vein. Then talking about the lateralmost structure to the femoral vein, we will call that as femoral artery. You can make out the artery clearly here. The above femoral artery, again from above downwards we have to see its origin and its termination. So talking about femoral artery, it is a continuation of external iliac vein. You can make out a vein here. This vein which is seen in the pelvic region, we will call it as external iliac vein, which is a branch of common iliac vein. So this is a artery. So this is femoral artery, continuation of external iliac artery, which is again seen in the pelvic region. So you can make out the artery clearly here. So this is external iliac artery which is going to continue as femoral artery below the inguinal ligament, and as it is reaching the femoral triangle, we are going to name this artery as femoral artery. This external iliac artery, it is a branch of common iliac artery. From this common iliac artery, we are getting two branches. Actually, one is internal iliac, another one is external iliac artery. So this external iliac artery is the artery which is going to continue as femoral artery. This femoral artery, which is again passing downwards, will reach the popliteal fossa, and there we are going to name it as popliteal artery. So femoral artery, it is a continuation of external iliac artery, and it is going to continue as popliteal artery in the popliteal fossa. You all know popliteal fossa, it is a space which is diamond shaped seen behind the knee joint. So talking about the branches of femoral artery, here in this femoral triangle, it is going to give 3 superficial branch and 3 deep branch. The 3 superficial branches of femoral artery are superficial epigastric artery, which is going towards the umbilical region reaching the abdomen part, and another artery which is going towards the anterior superior iliac spine, we will call that as superficial circumflex iliac artery. Later we will be having one artery to supply the pudental region, so we are calling it as superficial external pudental artery. So three superficial branches are one going above, another one medially and another one laterally. One is superficial epigastric and later we will be having superficial circumflex iliac to the anterior iliac spine. Then we will be having another medially to supply the pudental part, we will call as superficial external pudental artery. Same way we will be having some deep structures such as deep external pudental to supply the deeper parts of pudental region. Then after we will be having some muscular branches to supply the anterior part of thigh. Later we will be having important deep branch that we will call as profunda femoris artery. So you can make out this artery clearly here. So this is an artery which is going deeply. So we are calling that as profunda. As it is seen in the femoral region, we are calling it as profunda femoris artery, which is the important branch of femoral artery. So talking about artery branches, we will be having altogether 6 branches coming out from the femoral triangle. So 3 superficial and 3 deep branch. So now we are going to see important structure which is laterally placed to the femoral vein and artery, that is femoral nerve. So before going to the details of femoral nerve, we have to know that femoral artery and vein is covered by a sheath in the femoral triangle, which is not shown here. Here we will be having a sheath called femoral sheath, which is an extension from the fascia of abdominal region, that is fascia transversalis, a fascia which is going to cover the anterior part, and then we will be having posterior wall of femoral sheath which is coming from the fascia covering the iliacus muscle. So we are calling that fascia as fascia iliaca. So these are the two fascias which is extending downwards, reaching the femoral triangle in the upper part to cover these two structures and form a sheath called femoral sheath. Here femoral nerve will not be getting included in this femoral sheath. Why? Because this is a structure which is passing underneath through fascia iliaca. So this femoral nerve, it is a separate structure compared to femoral vein and artery. And talking about this nerve, femoral nerve, it is coming from lumbar plexus. So lumbar plexus will be having dorsal branches of L2, L3 and L4 are giving this femoral nerve. So this femoral nerve again will be having trunk part related in the femoral triangle. Later it will divide into two divisions such as anterior and posterior division by means of an artery called lateral circumflex femoral artery, which is again a branch of profunda femoris artery. I will show all those in a line diagram which will be easy for you to understand. So we will be having two divisions of this femoral nerve which is again giving branches such as cutaneous and muscular branches. Before going to the branches of anterior and posterior division, the trunk itself will give three branches, one for the iliacus muscle, another one for the pectineus muscle, and some branches to supply the artery. So then after, it is giving two divisions by means of lateral circumflex femoral artery. Again, anterior division giving two cutaneous and one muscular branch. Posterior division, it is giving one cutaneous and one muscular branch. We will go into the details of those things later. Before that, we will approach the floor of femoral triangle which we left behind in the boundaries of femoral triangle. So as we discussed earlier, femoral triangle base is formed by inguinal ligament and lateral boundary formed by medial border of sartorius, medial boundary formed by medial border of arecta longus. Talking about the floor, we will be having lateral to medial 4 muscles forming the floor of femoral triangle. One muscle is iliacus muscle. Then after we will be having a tendon of psoas major muscle passing. Later, medial to that, we will be having a muscle called pectineus muscle. And then medial to that, we will be having arecta longus. As we discussed earlier, arecta longus For the boundaries, we are taking medial border of erector longus, so the whole part of muscle will be included in the floor of femoral triangle. That's all about the details of femoral triangle which we have to know. And other structures such as deep inguinal lymph nodes and lateral femoral cutaneous nerve along with femoral branch of genitofemoral nerve also will be seen as a content of femoral triangle. Now we will move on to a simple image or simple diagram for the better understanding of femoral nerve and its branches.